Welcome, everyone, to the Happiness Journey with Dr. Dan podcast, where every journey is worth living. My name is Dr. Dan, and I'm your host for today's episode. I'm a bilingual cognitive behavior and neuro-linguistic practitioner specializing in anger management issues, both court-appointed and private, marriage and relationship coaching, dissociative disorders, narcissistic personality disorders, depression, anxiety, dream analysis, and also provide life, business, and retirement coaching support. I provide individual one-on-one sessions in both French or English, and also do group settings. If you need any assistance, reach out to DMV therapy and coaching services at 301-325-1550, and our website can be found on lifecoach.drdanamzallag.com. Now, in today's first episode of season 35, I'm very excited to have Kate Edwards, a passionate athlete who has pushed her body to the extreme limits and almost got too close to losing her life because of her extreme behavior. And we will also discuss the importance of listening to your body and to accept that we all have our physical limitation. Now, I personally relate to this guest because I have also taken my body to the extreme limits of bodybuilding and ignored many signs, muscle tears, spinal disc injuries, etc. So without further ado, and as with all of my previous episodes, I will leave it up to the guest to probably introduce herself, as no one else can do a better job. Kate, the floor is yours.
Thank you. Thanks for having me, Dr. Dan. I really appreciate it. My name is Dr. Kate Edwards. I am a physical therapist and I specialize in running medicine. I have a couple private practices in the Atlanta area. I also do consulting for people who have injuries that they really don't know where to turn anymore. They've been injured for a long time and have seen a lot of other people, and they're just kind of lost. But my story is one of I have been a runner for a long time, and I really love running, and I've been very passionate about it. And everything that I do in my life really kind of revolves around that. So it really had become my identity as a person to be this runner. And I treat runners, I write about running, I do running research. I am the director of the medical team for the Atlanta Track Club Elite. So a lot of what I do is really in this world that I love. And as you mentioned earlier, I was training for a half Ironman, and we'll get into it in a little bit, but I was training for a half Ironman and I went into ventricular tachycardia and I almost died. And that was a really big turning point for me in my life, and especially a life that was surrounded by running, and I was running and I was doing all these things, but I had to make a major life change.
Well, thank you so much for being here today, Kate. And like I said earlier, I relate a lot to your story because I think every athlete, and I've been in bodybuilding as well for many years. I still work out, but I'm not as extreme as I used to do, or I used to be, trying to squat a lot of weight, try to be able to leg press. I mean, my record was almost half a ton. So
Wow.
it was kind of like I pushed a lot with my body and without really caring much about the repercussion, because I said, hey, I'm young, I can heal. But that's not the way to look at it. I mean, it's once people go and do something, there's no turning back the clock. You could end up being paraplegic, you could end up injuring the spinal cord. So it's really important to listen to your body, muscle tears, muscle strain, and so on and so forth. So all this is really important for the listeners to really pay attention to all the signs that the body gives, and they will give you signs. So that's a given. Now, when it comes to the SVT, the supraventricular tachycardia, was it just because of you training for that specific Ironman athlete, or it was his pre-existing condition?
Yeah, so I didn't know, but I have a rare genetic heart disease called arrhythmogenic right ventricular cardiomyopathy, but now they call it ACM. And I had been training for years. I'd run 13 marathons, done several different triathlons, usually short course. This was the first big triathlon that I was going to do. And I had actually passed out. So talk about really listening to your body, as I had passed out in 3 marathons previously, and I continued to train. But one of the things is I did actually go to see 3 different cardiologists, and everyone said that I was fine. And so because of that, I stopped listening to my body even more, even when I had things that would come up where I'd get dizzy on a long run, or I would feel tightness in my chest, or I would pass out in a marathon. Everyone said I was dehydrated. And for a long time, I just said, okay, I mean, I understand training. I don't believe I'm dehydrated, but everyone thinks that I'm fine. So I am. But that continued. And then I got pregnant and I when I had my son, I decided to, get back into shape and to do my first half Ironman because I was actually training for one right before I got pregnant. So I decided to kind of go back into it. And when I started training again, I had different things come up again: shortness of breath, dizziness. I was incredibly fatigued, and it was a different kind of fatigue. It was like a bone deep fatigue. But because I was, postpartum and I was breastfeeding, I thought that those were typical things and those were normal. And so I kept pushing my body through it. The other piece is, when you go through a life change like that, having a baby, you do wrestle with this idea of identity. Who am I now as a person who's a mom? And, and still, am I an athlete? And so I got to the point where, I had pretty negative self-talk and I was pushing my body and telling myself, like, are you still an athlete? Can you still push this hard? And so the last run that I did before I went to another physician was I was going on this 5 mile run, training for this half Ironman, and I felt terrible. And I felt terrible all week, but I was in this space where I felt like if I didn't prove to myself that I was still an athlete, that I was no longer an athlete. So I kept pushing my body as hard as I could. And so right at that end of the 5 mile run, so about the last half mile, I pushed myself as hard as I could. And right before I stopped in front of my house, I looked down and my chest, I could see my heart beating outside of my chest. My sports bra was really tight. I started to get dizzy and I was feeling really bad. So I kind of stumbled to the front of my porch and I sat down, I put my head between my legs and I started to breathe. And I looked at my watch, my Garmin, and my heart rate had gone from 150 to 160 to 200, 250, almost 300 beats per minute before it stopped tracking. And I thought, oh, this Garmin is broken. Well, it
Oh,
wasn't broken. I was in ventricular tachycardia.
oh my God, that's yeah. Did you do like any like there's like I think a surgery where they send electric shock to the heart to be able to bring the rhythm back? Is that something that you were considering to do?
No, so what happened was it actually converted back to a northern. I'm very, very lucky. So most people that have what I have die, and that's how they find out. There are several people that make it through, but I was very lucky because it's actually the third time I didn't realize it. I had been in ventricular tachycardia, but my heart actually came back in a more normal rhythm. And that's probably the worst part about it is it came back into a normal rhythm. I was really tired that day. I didn't really tell anybody, which is, not typical. I'm a healthcare provider. I'm a physical therapist. I should know better. But when it comes to your own body, sometimes you're not as aware. And the next day when I went to work, I told my colleague, and she said, "What are you doing here?" And they canceled all my patients and they sent me to see a doctor that day. And that was really the beginning of it was actually a 9 to 10 month journey to figure out what was wrong with me. And it was this period of time where I really felt like I was losing pieces of myself because my identity was so tied up into being a runner. And over time, they said, you can't run as fast or you can't run as hard, or maybe you should stop running altogether. And so over this, 9 to 10 months, it really changed who I was as a person and, my priorities and, who I believed I was.
So the when you had this tachycardia, the
Mm.
cardiologist never suggested cryoablation or radio frequency energy ablation or something to be able to bring the heart back to a normal rhythm?
So it didn't have to be brought back to a normal rhythm. It brought back itself back to a normal rhythm that day. And then I went in, the reason it took 9 to 10 months was because I went in and had several tests and I kept passing all of the tests. And so they weren't seeing everything until one day I was in there and my doctor said, "Can you make it come on, that feeling?" And I said, "Yeah, of course I can." And nobody had
That's
ever asked me.
okay.
And so I said, "Okay, I can make it come on. I just have to run really fast and really hard." He said, "Okay, let's get on the treadmill." And to this day, we laugh about it because made him so terrified. I went and I put the treadmill really fast and I put it at an incline and I ran as hard as I could. And I didn't feel it come on, but I went into ventricular tachycardia and all of a sudden I hear him yelling, "Stop the treadmill, stop the treadmill, everybody stop the treadmill, get her off the treadmill." And I was like, "I'm fine, guys. I think it's about to come on." And they're like, "No." So I stopped the treadmill and sat down. And then when I stopped, I started to feel it. And so that was the first time someone asked me, a provider asked me to bring it on, and I was able to. And that really struck me because as a practitioner myself, you really have to ask the patient that's in front of you, and you really need, they know more about their body than you do. And it was just a really good learning point about how, we really need to ask the patient in front of us where they are, how they're feeling, what's going on in their body. Because if he hadn't asked me that, we would have still been, trying to figure out what was going on.
But then the fear of this to happen frequently, Kate, in terms of every time that you get that you bring your body to the extreme, you get to a ventricular tachycardia. So is there a way to be able to kind of, I mean, even if you stop the exercise, then the heartbeat is going to go back to normal.
Yeah.
How long is that episode lasting from the 250 beats a minute to going back to the normal 70 to 80 beat a minute?
Yeah, so I did end up having a cardiac ablation, which is something that you were asking me. I just hadn't, I did that several months later, which helped. So it did help my rhythm. And they still didn't know what was wrong with me. They thought it was an SVT. They didn't realize it was a rare genetic heart disease at the time. So I did feel significantly better. My fatigue rebounded. I wasn't so tired. Before I had the ablation, I actually was falling asleep at like 7 o'clock at night. I thought it was because I was breastfeeding and I had a baby. But it wasn't. It was my heart. And I really couldn't get off the couch and do the things. And I was, a big time endurance athlete and had lots of energy typically. So that did help. And then eventually, there isn't really anything you can do. This isn't a heart disease that you can get rid of. It's a progressive genetic heart disease. And so I eventually got a defibrillator. So I have a defibrillator if I go into an episode again, and I'm on antiarrhythmic medication. So those are some of the things that I have to do because I did push my body so hard and this gene, came on. And there's a lot of question around, what drives the gene to switch on. They believe it's the amount and the intensity of exercise that you do if you have it. But I do like to say, make sure everyone knows this doesn't just happen to anybody. You have to have the genetic predisposition. So it is rare.
No, absolutely. But and what about did they diagnose you for any PAC or PVC?
I had PVCs, yes, and that's part of what they were looking at on my ECGs, and that's part of what they were trying to help with when they did the ablation,
Interesting.
and also with the medication. Yeah.
I've noticed as well, and that I didn't know. Anyone who takes any of the like melatonin, do you know that melatonin taken for a long period of time can cause PVC?
I actually
You
didn't
didn't know
know
that?
that. No.
Yeah, it can. And because I had actually, in my situation, actually, Kate, I had where my endocrinologist, because I'm dealing with Hashimoto disease, and my
Mhm.
endocrinologist, when he was giving me my Synthroid or levothyroxine to be able to treat hypothyroidism, he gave me a high dosage of Synthroid, and that made me hyperthyroidism. And you know that one of the factors or one of the symptoms is very high heartbeat. So I was
Mm.
not understanding what caused it because all my life I was hypo. So I did tests. I went to the cardiologist. I did everything I could to be able to figure out. They put me to a stress test and they said, look, there's some cases where I think you may have SVT because the heartbeat I was feeling the fluttering of the heart. And then when I did
Yeah.
my thyroid test, I said, holy cow, your thyroid, you're super hyper. I said, that's impossible. I've been hypo all my life. So those who actually are hyperthyroidism, they may also feel like their heart is going 100,000 miles an hour. So that's important to be able to kind of check your thyroid hormones, the thyroid secreted hormone, to be able to figure out if you're taking too much dosage of Synthroid or levothyroxine. But I also researched that when you take melatonin, which I had a lot of difficulty sleeping because of my hyperthyroidism, that causes PVCs.
Mm.
That's very, very interesting. So people have to check how much melatonin you take because you may feel some either premature atrial contractions or the ventricular contraction. So it's important that people have to really research about their well-being because sometimes what we put in those medication, even if it's natural, because melatonin is being produced by the body, that can also cause PVC. So that's really, really fascinating. And I didn't know that, so I stopped completely and my PVCs are gone.
Yeah, it is pretty amazing what the body does and how it accommodates, isn't it?
It's incredible, incredible. So now that you had
Yeah.
the ablation, you said that it reduces slightly those issues that you dealt with in the past, but you still sometimes when you do exercise a lot, you still feel going back with the ventricular tachycardia.
No, I'm not allowed to do exercise a lot. So I do exercise and within a lot of parameters really now. So I lift weights 3 times a week. It's not crazy, but I definitely do it 3 times a week. I walk a lot. I can do yoga. I do run once a week usually, but it's about 2 miles. It has to, maybe sometimes three. It has to be with someone and it has to be very slow. So my ablation definitely helped with the ventricular tachycardia, but the thing is, because my disease is a progressive disease and it impacts both the electrical system and the actual heart muscle itself. It's not one of those things where you can get a procedure and it's better. And exercise makes it worse. So the more exercise I do, if I do extreme exercise, that can also make it worse. So I was actually set up to do a second ablation at one point, but then we decided not to. We got in there and my doctor didn't do it because that's when they really realized what was going on. It's not something that can just be, fixed with an ablation. It's because it's not an SVT. So it's yeah.
But do you deal with any syncope anymore, like fainting or anything of that
I
sort? Or-
don't anymore. So this happened about 10 years ago. My son is 12. So the day that I really went into ventricular tachycardia and I'd say I almost died was on my son's first birthday. So it was about 11 years ago. So that was also part of the emotional trauma of it, right?
Yeah.
It was his first birthday. So that was 11 years ago. And in 11 years, I've really changed a lot in my life. So stress does impact
Mhm.
your heart, and we know it impacts well, it does impact every system in your body.
Yeah.
And so I've managed my stress. I'm a big meditator now. I, don't push myself as hard as I used to now. Everyone would laugh that knows me because they all think that I do way too much all of the time, but I really do feel like it's a lot less than it used to be and a little bit differently. It's more mental work and
Mhm.
I work a lot because I love it. It's just not as extreme exercise anymore.
And do you practice any like vagus nerve stimulation by any chance that can
I
actually?
don't I don't stimulate the vagus nerve. I know exactly what you're talking about. I do a lot of breath work though. That's all I've needed to do is breath work and meditation, and that's really managed my anxiety and also just my life in general.
And then you mentioned that it was degenerative. So does it mean that your lifespan is shorter?
Maybe, maybe not. It depends. And so they've been tracking it for a long time, well, 11 years, and the progression has not really been a lot, which is very good. But it has to do with the fact that I stopped the extreme exercise.
Okay.
It wasn't, very, very bad when I got it. It's different in every single person. So I like to believe the changes that I made in my life have made it so that the progression is slower.
Okay.
And I'd like to believe that, that I've helped to change the direction in which I was going because I am better. I forget that I have this a lot of times, which is amazing. And that's really not the case for many people. Some people end up with heart transplants. Some people are really uncomfortable and can't work because they're just in so much pain and anxiety all the time. So I really feel like I made a lot of changes that put me in the right direction. But I don't know. I mean, I don't know if this is what I will what'll die of someday or not.
Well, no, we will all die someday. The question
Yeah, exactly.
yeah, but the question is that if that stops you from doing something that you're so passionate about, the running part, etc. So it's taking away something that make you feel like
Hmm.
validated or whatever it is. So I think that many people who are taking away the thing that they love the most, they feel that then what's worth life living kind of thing.
It took a lot of therapy, honestly, to get where I am today too. That's the thing is you have to make a decision. When something like this in your life happens, you have to make a decision how you're going to move forward. And everybody manages things differently. Um, I luckily was the kind of person that said, you know what, I'm not going to let this ruin my life. This really stinks. And yes, it's my identity. It took a lot of work, but I decided that, I had a 1-year-old at the time. I was married. I had a very successful career in terms of physical therapy. And I said, there are other things I can do. Do I miss running? Yes. Do I wish I could do it all the time and compete? Absolutely. But there's other things out there. One of the things I really help my patients do is realize that you can love something as much as I love running, but you can also find things outside of your sport that will also give you joy and happiness. And that's what I've been able to do, luckily.
But that's amazing. And the thing is that the passion that you have for exercise, for sports, sometimes too much of a good thing can be a bad thing. Come to think of
Yeah. Yeah. It's right. Well, you can't wrap your identity up in one thing and expect to be fine if something takes that away. That's it, right? So if you believe you're this one thing, when you lose that one thing, it rocks your world. It changes everything. So it's really important to be able to understand, like, we can't just have one thing. We need to expand our horizons. We need to think about, okay, are there other things in our life that bring us joy, and what are they? And so again, that's what I have my athletes do. Whenever I write a return to run program or a training program for whether it's an elite athlete or an everyday athlete, there's a whole column that says, what are you doing today that you love? Or what is something fun outside of your sport? And they have to write it in their training program.
Absolutely. Like my sister who lives in Montreal, actually she loved doing marathons and now she has sciatica. So now she cannot
Oh,
do anything of that sort. So for her, yeah, she tried to do like bicycle. She still tried to be as active as possible, but at the same time, it's kind of like she has limitation because of the pain that she has in her legs. So I'm not sure if it's part of neuropathy or anything of that sort, but yeah, it's she felt disappointed, but she said, look, that's not going to stop me from living. I'm just gonna have to stop a few things that I was passionate about. But now she's okay with that. She kind of like accepted her fate.
yeah. And it's a really hard thing to do. And that's, I think, one of the things that my patients struggle with the most is not being able to do the thing they love so much. And eventually, most of my patients, it's a physical therapy issue, so musculoskeletal, and so they're able to get back to what they love to do. But I hope that when they're with me, I can change their perspective enough to know that that's not the only thing that they probably love in life. They just needed a little nudge to find the other things.
Oh no, absolutely. But during your journey, like through the process of like doing all the running and all that, have you dealt with ACL replacement? Have you dealt with meniscus tear? I mean, I'm sure that all of that must have been a part of the equation.
I mean, those are things that happen that come to physical therapy all of the time. In my clinic specifically, we don't see a lot of ACL tear because we don't see a lot of post-op patients. We actually see a lot of people who have seen multiple providers and not gotten better anywhere else, and then they end up in our clinic. Or their most injuries for runners are more overuse, whereas an ACL injury is typically because of, somebody playing soccer or jumping in basketball or planting and twisting. And then in terms of meniscus, we do see meniscus but we usually typically see degenerative meniscus from like a lot of loading over a long period of time. Sometimes it'll be a tear, but most likely it's not like an acute tear just because of the type of patients we see.
Oh, I see, I see. So now that you still are a physical therapist in Atlanta, is that correct?
Yes, that's right. I own two cash-based physical therapy practice that specialize in runners and triathletes.
Oh, okay, okay, perfect. And so what is for those who are listening to our podcast at this moment who are going through that similar situation as you and I did in the past, what
Yeah,
do you recommend when it comes to the symptoms that they have to really pay attention, not ignore it just because of pride
yeah.
or because of ego, because let's face it, we do have an uh
Totally, totally. I mean, that's what happened to me. And fear also. You ignore it because you don't want to address that it could be something wrong.
That's correct. So when do we have to be, or when do those listeners have to be concerned? And sometimes just have to say that, okay, maybe it's something that relates to, like maybe not being hydrated enough, dehydration that can cause also muscle tension, all that. So is there something that has to be kind of thinking in their head to say, oh, this has been repetitive enough. I need to pay attention to it. Or if this is just a one-time thing, okay, that must have been just a fluke.
Yeah. So a couple things. So if it's a musculoskeletal injury, I usually say if it's there for more than 7 days, go get it checked out. That's a baseline, easy enough thing. So if you're like walking around hobbling, you think you have plantar fasciitis, most people wait like months or even years to get it treated. But the sooner you go in, the sooner it goes away. But then for something like what happened to me when it's cardiovascular, something much more serious, if if you're having symptoms during exercise, then you should probably go see somebody who specializes in, sports cardiology. And an athlete's heart is very different than a non-athlete's heart. So it's always good to see someone who does sports cardiology. So if you have symptoms that are during a run or during exercise or immediately following, then that's when you should be more aware and go see somebody. So, shortness of breath, tightness in the chest, increased fatigue, not regular training fatigue, but just like fatigue that doesn't make sense based on who you are and your type and level of training. Also, sometimes it's just like sometimes there's a little bit of confusion or your heart rate's all over the place, or you notice fluttering in your chest, like you mentioned. I do get that periodically. Sometimes it's a racing heart. So there are a lot of different symptoms, but they're usually more serious in nature. And sometimes they're things you'll brush off, like, oh, I just kind of feel this fluttering, no big deal. And it probably is no big deal, but it's always good to, be checked out by somebody like a sports cardiologist.
But like heart flow, I mean, it can be caused also with high cortisol level in the body because of stress, as you mentioned before. But it
Oh,
will have
yeah.
heart have a very low beat per minute. So something like between 54 and 59, or something we can go down to 44, which is very, very slow. But for an athlete, that's normal heartbeat versus the 60 to 100 beat per minute that we see on regular hearts. But when it start going up and down, like an EKG, and it's like we go 200 heartbeats per minute, and then it goes down to 60, then it goes back up again. Is
Yeah,
it
exactly.
about, or is it something that maybe it's primarily due to exercise?
Yeah, so my heart rate used to be 36. That was my resting
Oh,
heart rate
oh, that's very low.
when I was yeah, when I was training. Now it's still low. It's in, 50s, 60s, even though I don't train as much. So there's a genetic component to that as well as training effect.
Mhm.
But when your heart rate's jumping all over the place, I would, it should move in a way that's almost like a graph, like it's slowly going up and slowly going down. It shouldn't go up and down and up and down and up and down during exercise. That's definitely something that needs to be looked at.
Okay. And for people who are actually trying to lose weight, and then there's what we call it the fat loss zone versus the cardiovascular zone. They have to be like to maintain a certain percentage of the body weight, or there's a calculation. I don't remember exactly the accurate mathematical equation to be able to put themselves in a specific zone to be able to lose fat versus cardiovascular health. Now, in your case, you
Right.
had a good cardiovascular health, but because of your pre-existing condition, that was not something to be that you had to put yourself in terms of like fat loss, because I'm sure that fat was not a part of your body. But you the cardiovascular health, that's something that if you put yourself in a certain zone, which is I think 90% of your is it 90% for the cardiovascular and 65 for the fat rate or something like that? If I
We do it in like zones.
Yeah.
So like zone 2 is the fat burning zone. And then zone 4 to zone 5 are the really high cardiovascular zones. And so and you have to kind of see what zone you are based on your heart rate. And I don't really, since I'm not a coach, I don't necessarily give people zones to train in all the time, but you can figure out like what your zones are and what your heart rates are if you do like a VO2 threshold
Yes.
test, which can be really, really helpful, especially for athletes trying to figure out like what kind of training they're doing. And, for runners and triathletes, if you're always in, say, zone 4, then you're more likely to get injured than if you sometimes train in zone 2. And zone 2 is fat burning, but it's also where you build your engine. You know what I mean? So it's doing something like a VO2 threshold test can be incredibly helpful to figure out how you need to dial in your training and prevent injury.
Excellent. That's amazing. Now, before we end this podcast, can you just let people know where they can find you in case of, their whatever expert they want to go see, they didn't work out for them?
Yeah, sure, of course. So there are a couple things. I have my private practice where I treat periodically, but I have an incredible team of physical therapists, and we do mentoring all the time, and we work together all the time. So that is Precision Performance and Physical Therapy in Atlanta, and that's precisionpt.org.
Mhm.
If you want to, get in touch with me, my website is katemihivicedwards.com, and Mihivik is spelled Mihevc. That's also my Instagram handle. And that's where I'll do some private consulting in terms of, return to run programs, running injury, that type of thing, if you can't come into a clinic of mine. And then I also have a running app called Run Source, and that has about 45 experts that are on the app that know all about running, from sports dietitians, sports psychologists, MDs, PTs, and we build out injury programs, which is really cool. And then lastly, I have a podcast called Interdisciplinary Case Miles, and that is with a sports physician, so a running medicine doctor, and a sports dietitian, and myself. And we actually break down injury cases and running cases from all of our perspectives and how we would work together. So that's pretty fun, actually, if you're into learning more about running injuries.
Beautiful, beautiful. Well, Kate, that is all the time that we have for today's podcast. And again, thank you sincerely for taking the time out of your busy schedule to join us. And we all appreciate your participation to this episode by sharing your personal journey and advice to listen to the signs your body gives and never ignore these signs. And also, being an athlete is definitely a great achievement. But what is the point of being buried 6 feet on the ground because of ignoring the many injuries your body had to suffer from? So be wise. It is not worth it. And trust me, I talk with experience. Also, to our millions of listeners out there, we hope that you've all enjoyed today's episode as much as we did. And also, we're very excited for what's ahead in season 35 of the Happiness Journey with Dr. Dan podcast, featuring a lineup of incredible guests with powerful stories that will continue and uplift and inspire all of you. Now, here are some concluding words of wisdom. To every athlete chasing greatness, your body is your most valuable teammate. Pushing your limits can build champions. By ignoring pain can cost you the very life you're working so hard to elevate. Injuries are not signs of weakness. They're a message asking you to slow down and heal. We're not cybernetic organisms built to override every warning signals. True strength is knowing when to rest, recover, and protect your future. One missed workout is far less costly than a lifetime of regret. Listen to your body, respect its limit, and play smart. The goal is not just to perform today, but to live strong for decades to come. Greatness is measured not only by how hard you push, but by how wisely you care for yourself. My name is Dr. drdanamzallag, and you may all keep pursuing your amazing journey in life. Stay tuned for our next episode.